Good morning to those of you in the Central Time Zone. Good afternoon to everyone else. I am Lori Reeves with the Florida Perinatal Quality Collaborative, and we are here to welcome you to our Physician Leadership in Respectful Maternity Care webinar. And we have already asked, as you join us, please type in your name, your hospital campus, and your role into the chat. You see some examples already there. Next slide, please. There we go. We go ahead and jump to the next slide. We really want to welcome you to this webinar. We do understand that physicians have challenging schedules. Everyone who works in clinical healthcare has challenging schedules. So we are recording this webinar so that it can be watched later. So if you've got colleagues that wanted to participate but were busy seeing moms or babies, please let them know that we will have the recording posted so that they can watch it later. A little bit about the Florida Perinatal Quality Collaborative. We were founded in 2010, so we are now 14 years into working on our vision that all of Florida's mothers, infants, and families will have the best health outcomes possible through receiving respectful, equitable, high quality, and evidence-based perinatal care. And you see respectful is bolded there in our vision statement, but it is a core component of our vision statement, and we feel very strongly that it's one of the most important things that our hospitals can do for the people in their care. Next slide, please. We have no disclosures to offer. Next slide. And so just to note, I did already mention the webinar is being recorded. Please make sure that you mute yourself if you're not actually speaking. So as a courtesy to the speakers and to the other participants so that we don't get background noise. And we already asked you to put your title and other information into the chat. Next slide, please. Before we talk about the agenda, I just want to say one of the reasons we're offering this webinar is as a response to what several of our hospital teams in the Mother-Focused Care initiative have asked for. And they've said that they need a little help with physician engagement and respectful maternal care. So we put this webinar together with some of our clinical leaders, and I think it's going to be a really exciting session with a lot of great information packed in. We'll have some experiential activities included. We're trying a new thing with the whiteboard and post-it notes, and we're hoping that works smoothly. We're going to talk a little bit about why respectful maternity care is so important, review some of the e-learning platforms, and the ICM interactive training. And then we're going to look at implementation strategies to address, sorry, windows are popping up in front of the slide, to address physician engagement and time, nursing time, etc., followed by a Q&A, which we hope will be interactive and that you all will jump in and participate in that. Next slide, please. So our learning objectives today, we want to recognize how experiences of respect and disrespect in OB care impact both the patients and the clinical teams. And that we address challenges of providing that education to physicians, nurse midwives, and nurses. We're going to look a little bit about some of the data that our hospitals are reporting about who is getting trained and the improvements or failure to improve in some cases in training for both nurses and physicians. And we still have plenty of time to get this done. Our goal is to make sure that we reach our training goals before the end of the project. So don't despair or beat yourself up if you haven't done this yet. Our goal is to help you get where you need to be. We'll talk about how on-demand trainings can complement experiential in-person trainings and examine opportunities on how you can adapt trainings in creative ways to meet the needs of your hospital and department. Next slide, please. We have some amazing speakers today, and this is really exciting. We have Dr. Alyssa Brown, who is the Chief of OB/GYN at Tampa General Hospital. And we have Jessica Brumley, nurse midwife, who's president-elect of the American College of Nurse Midwives. Next slide, please. And also we have Margie Boyer, who is our nurse clinical lead and on all of our maternal initiatives, along with Nicole Pellegrino, who is one of our staff members and a QI analyst who has helped Jessica Brumley developed the respectful maternity care training that we have been doing around the state for our hospitals that are participating in the Mother-Focused Care initiative. And with that, I'm going to hand it off to Nicole, who's going to start us off with a poll.
Hi, everybody. Thank you so much for joining us today. So this is a poll question that we wrote for you. We just want to get a sort of temperature read on where we're at right now, and then we will move into the meat of the webinar. So the question is, what is your biggest challenge in engaging physicians in respectful maternity care education?
I just launched the poll. Are you all able to see it?
Yes.
Perfect.
Give folks about 10 more seconds to answer.
All right, and with that, I will close the poll and we can go over the results together. Are you all able to see the poll?
Yes.
Perfect. All right. And let me pull up the answers for other. It looks like the top categories here are time constraints, lack of interest, and lack of perceived need. Not knowing where to start was also one of the higher categories there. And for those that did provide other, we had that Relias training is okay, but it's harder to fit in. Physicians are not employed by the healthcare system, no oversight, and finding a speaker that they will find appropriate and engaging.
Right. Thank you so much for that, Ben. All righty. So with that, let's move into a discussion about the background on our Mother-Focused Care initiative. And we're not going to get too deep into this today because this isn't really a data webinar. We have some fun events coming up for you that we'll talk about at the end, where you can hear more about Mother-Focused Care data. But today we're just going to give a high-level overview so we can get into the content a little bit more. So as you can see here, the focus of our Mother-Focused Care initiative, MFC, as you'll hear us refer to it as, is to assist hospitals and providers in transforming their culture and environment to respectfully serve all mothers and their families and helping them to meet their needs. About the same time, we adopted our new vision statement that include respectful care. We also decided to include respectful care as a universal component of all of our initiatives, which is exciting. So moving forward, every single one will contain some elements of respectful care. This initiative, our Mother-Focused Care initiative, is new in the sense that this is the first time we've ever worked it into an aim and drivers. So as you can see here, the orange rectangle under the secondary aim, it says have 80% of providers and nurses attend an RMC training since January 2023, which is when this initiative kicked off. And then you can see in smaller letters, it says RMC training that includes topics defined by FPQC. So we will let you know what those topics are shortly. Then you see in the drivers themselves, RMC, it says learn, define, commit, and implement respectful care for mothers and learn over time how well they are performing. Our secondary drivers next to that say educate provider and staff about respectful maternity care and its components and strategies, develop a hospital commitment with providers and staff support, and implement and use an ongoing respectful maternity care survey and other methods of maternal feedback to improve care. So we're going to touch on all of those elements today, but we will mostly focus on actual education and training. So through this initiative, we developed one of our work groups. So we sort of, when we develop initiatives now, we break into work groups based on driver. And so the RMC work group that was headed up really by Jessica Brumley, and I was in it, and several other people on this call were also in that. But we came up with a definition that we felt pulled from some of the major leading clinical organizations, and then sort of made it sort of initiative specific or Florida specific in a sense. So, but we say here, respectful maternity care refers to care that is, maintains dignity, privacy, and confidentiality, ensures freedom from harm and mistreatment, enables informed choice, self-determination, and respect for a patient's preferences, ensures access to continuous support during pregnancy, labor, childbirth, and postpartum, and enables access to evidence-based care, a safe and inclusive physical environment, and necessary resources. So this is just a really quick background, sort of historical background on RMC. Those who've attended previous meetings with us have probably seen this this diagram before, but it can't hurt to share it with all. So RMC is founded on the premise that women should not be mistreated in childbirth. And obviously there have been efforts forever to make maternity care more respectful, but as a sort of definition, really it came about in the 70s in the international recognition of the need for respectful care by women giving birth. Clinicians, particularly midwives and doulas, really pushed for this. In the 90s, there was an increased cohesion, particularly in Latin America, around addressing obstetric violence. In the year 2000, there was a conference in Ceará, Brazil, that actually where major organizations got together to better define RMC. In 2010, the major USAID landscape analysis came out called Exploring Evidence for Disrespect and Abuse in Facility-Based Childbirth. And that called for evidence-based interventions to address RMC. And then in 2011, the White Ribbon Alliance published Respectful Maternity Care, the Universal Rights of Childbearing Women. They have updated that since. But this is where a lot of the work, the recent work in respectful maternity care sort of finds its roots in. Part of our work group was defining key education, key components. And I touched on that briefly when we were looking at the key driver diagram. We defined these, and we didn't pull these out of thin air. These actually came, again, from some of the major clinical organizations, and then from past work we've done. Things like trauma-informed care has been a topic that FPQC has been working on for several years. And so we were able to take in some of our materials that we'd already been using, adapt them for the initiative, improve them, and make sure they are up to date, and then pull in information from that others have worked on. And you know, the old adage in QI, we steal shamelessly. So so we did that for some of this, and you'll hear a little bit more about that. But these are the components that we ask our teams to cover in their RMC education. Shared decision-making, what does RMC look like? Cultural humility and cultural competence, recognizing burnout, the patient as center and meeting them where they are, trauma-informed care, partners and other family members, the role of doulas, bodily autonomy and consent, stigma, acknowledgement of past pregnancy and birthing experiences and loss, communication amongst team members about RMC, and shared decision-making. We also developed a commitment because we asked our hospitals to ask their teams to commit to RMC. So we wanted to give them a sort of blueprint for that rather than saying, hey, go figure this out. So we developed this list of 8 sort of points in the commitment to respectful care. They're actionable strategies. We found that to be super important in this work. We want people to say, this is how I can do this. We also, told teams use this as it is or adapt it for your own teams. Some teams have taken it as is, adopted it, and some have adapted it. And then we've heard this from a lot of our teams actually, to start bringing this in as a standard part of new team member onboarding. So one of many creative strategies to get the team on board. We also created a survey. Other collaboratives call this a patient-reported experience metric, but we call it RMC survey. We sort of made it our own. We created it in 3 languages: English, Spanish, and Haitian Creole. Patients can scan a QR code. They can enter a short link into a browser or complete it on a hospital iPad, and it takes them to Qualtrics. And the point of this is that hospitals can receive this information, know how their patients are feeling about their care, and hopefully work to improve those experiences for their patients. So now we're going to move on to the discussion of the RMCE modules before we discuss the sort of in-person modalities. So I'm going to pass the torch now to Dr. Alyssa Brown.
Hey, good morning, everybody. My name is Alyssa Brown. I am an OBGYN at Tampa General, where I currently serve as the chief of OBGYN. We're a pretty busy, robust place, 7,500 deliveries per year, physicians and different obstetric providers in different clinical settings. So we are also engaged in this work and experiencing some of the challenges that you guys discussed in that poll, those time constraints and getting the interest. So some of what we are suggesting and discussing here is based off of our own experience. And we recognize that there are many different hospital settings represented on this call. And so it's not intended to be a one size fit all, but hopefully, there's something that you can pull from some of the discussions that we're going to have later on in the talk that you will be able to right size to your own institution and help facilitate getting out that education that we need. So back in the fall of last year, the CDC compiled some data from maternal mortality review committees statewide across the nation. And in that report, they indicated that a substantial amount of those committees were seeing that discrimination was a major contributing factor to pregnancy-related deaths. We all know the ongoing work that has been done, but we have seen, despite those ongoing efforts, there has been a worsening in that data. And so specifically, that report highlighted 2 key facts related to discrimination and kind of highlighting the need for respectful maternity care. Specifically, 40% of Black, Hispanic, multiracial patients had experienced some form of discrimination throughout their prenatal course or delivery. And what's more, 30% of women in that same category had experienced some degree of mistreatment as it pertained to that discrimination. So again, kind of highlighting that need for respectful maternity care. In response to that report, ACOG released a statement really reaffirming their commitment to educating and providing resources to the members on the principles of respectful care. Specific language taken from that statement are: it is imperative that pregnant and postpartum patients feel comfortable communicating with members of their healthcare team. Respondents in the survey that the CDC cited said that they held back on discussing concerns or asking questions because their healthcare provider seemed rushed or they didn't want to appear difficult. And it demonstrated that we must continue to work harder to provide more patient-centered care. So clearly, one of the foremost clinical organizations on OBGYN highlights the need for this work. And so when we think about going back to the poll where there was a perceived lack of interest related to it, really highlighting that this is, ACOG, our governing body, this is what they are suggesting that we need to do to move the needle forward as it pertains to maternal mortality. And so ACOG is able to further some of these efforts through work with the Alliance for Innovation on Maternal Health, or AIMS. And so we often talk about respectful maternity care as a standalone topic, but ACOG really recognized the need to really infuse and weave those principles into all of their AIM bundles. So whether we're talking about obstetric hemorrhage or hypertension or preventing the primary C-section, we understand that respectful care education is inherently woven into all of those AIM bundles. Next slide, please. So I'm really going to discuss specifically ACOG has e-modules that they've crafted in response to that CDC report that we talked about. The target audience is for OBGYNs, but it is recognized that this information could be easily applicable to any obstetric provider, whether that's family medicine doc, nurse midwives, other interprofessionals that are interfacing with maternal care. If you have an ACOG membership, it is free, so there's no additional cost to members of ACOG. And the goals of these modules are really to help provide insight that will give clinicians the skills to effectively offer respectful care. And we understand that improving respectful care will overall improve patient health and patient outcomes. What is nice about this, and this kind of goes back to that incentivizing docs, is that you do earn CME credit for successful completion, basically commensurate to the time spent completing the modules. Next slide. So there are about 3 subsections included in the e-modules. The total time of completion is about 90 minutes. ACOG has really been thoughtful in the rollout of this e-modules. And so while each subsection is about a 20 to 25-minute video vignette, they built in time for reflection and discussion, which I really like because it really enhances the quality of the modules. So as I said, divided into 3 learning modules. The first topic is race and equity in OBGYN. There's also a historical foundations of OBGYN and then respectful care in OBGYN. We've highlighted here the respectful care in OBGYN because although these were intended to be used kind of as a series and builds upon each other, we do identify that there are time constraints and there are challenges. And so if needed, that third module really can stand alone as its own training because some of the concepts of the race and equity in OBGYN and the historical foundations are touched upon in the respectful care module. Again, just kind of highlighting that respectful care module, which is about 20 minutes runtime, can be used as the standalone training. Again, some of the historical context are touched upon. You know, I've been able to go through the modules myself, and I do find that a lot of the historical concepts, the anti-racism education in those first 2 modules really do lends itself to making the conversations around respectful care more robust. But understanding time can be limited if needed. Again, that respectful care module really does suffice as a standalone education material. Additionally, what I like about the modules is that there is a discussion guide related to it that can help some of that reflection. And so a strategy that you could use for really busy practitioners that you can't all get into the same room is that you could have this kind of like an assignment that providers can do individually, kind of at their own pace, that doesn't require as much scheduling and coordination. But again, group settings are always really nice. We love that RMC really isn't intended to be just a checkbox. And kind of thinking of that, group discussions really do further the conversations. Additionally, ACOG has discussion guides and additional resources attached to each one of those subsections. So they really have thought out very carefully the information. It touches upon many of the key components that Nicole mentioned earlier in the webinar. Again, this is just a pullout from that discussion guide. So some of the questions that they ask to help spur either discussion if it's in a group setting or just, introspective reflection if someone is doing it individually. And so next I'm going to turn it over to Margie, and she's going to talk about similar training from AWHONN.
Thank you, Alyssa. That was awesome. I'm going to talk to you all about what AWHONN has to offer around respectful maternity care. The first thing is there is a respectful maternity care framework. It's a beautiful infographic that includes the care team, the patient, puts the patient in the center of everything we're doing. AWHONN also offers RMC evidence-based guidelines. Anyone can access those. There is a complete toolkit. Inside this toolkit, there are videos, there are links to relevant resources, everything you would need. Now, I will tell you that the toolkit is free for members, but there is a cost involved if you're not a member. It can also work with hospitals if you wanted to look at a bundle. And CNE is offered through the toolkit. Now, there are also free webinars with AWHONN. There is one anyone can access, which is a recorded session of Rose Horton, who is a nurse expert around respectful maternity care. It's an hour long. It's an easy webinar that anyone can watch. We will be giving you all these links after the session. Go ahead, next slide. So here's just drilling down into the respectful maternity implementation toolkit. Again, this comes with all the tools and resources you would need. The guiding principles are all around awareness, mutual respect, shared decision-making, informed consent, autonomy, dignity, and accountability. So I know many of the nurses out there are members, because I see you all out there that you probably have already downloaded your own free copy. Next. AWHONN has what we call the 10-step journey. I love this, just like with Baby Friendly, we have our steps. So this is a 10-step journey. The acronym is CARE PATH. So basically, I'll just briefly talk about what each letter stands for. The first one is for you to confirm commitment. This is the first step you'll need to do. Want to make sure you have the C-suite support. You have your commitment statement. Some hospitals put the banner up, have everybody sign it. Second step, assembling that team. You want to make sure everyone, not just nurses and doctors, are on this team, but anyone that comes in contact with the patients can be a part of your team as well. Frontline is key when you're assembling your team. The next thing is to relate readiness. This is where hospitals do what some people call SWOT analysis. What are our strengths, weaknesses, opportunities, and threats? It's really just assessing your organization and asking the question, are you ready for respectful maternity care training? Educate all is E, and this is what we're all about today. This is just one example, but remember, we always say it's not a one and done. It's ongoing education and training, which is what the FPQC training is all about as well. Next, we go to P, which is the policy development. So you want to review all your policies, have your frontline nurses, doctors review the policies as well. Unit-based counsel is a great place to take your policies. The next is an A, which is adapting your culture. This is where we talk about, we ask the question, are we really walking the walk? Is this enculturated within our team, within our organization? Accountability, I love. This is where you ask yourself, are you holding yourself accountable? Are you holding your team accountable? Are you allowing people to make fun of someone's birth plan at the nurse station? Things like that, really holding each other accountable. Some people have buttons, some people have t-shirts. Hospitals have done some really creative things around accountability, so we're accountable to our patients at all times. T is tailoring the data, and I love FPQC because PQI does this for you, and all of you are members. You get your PQI reports, so this is already one way you can tailor your data. T is testing. On our coaching calls, we always talk about small tests of change. Again, this is a big piece of the AWHONN Care Path 10-step journey. And last but not least, we want to hold celebrations. So have a celebration, and the important thing is don't wait till the end. Each step you want to have a celebration. So we always say celebrate each step, celebrate early, and celebrate often. And the bottom line is, this is our mantra, we respect every patient, every interaction, every time. And with that, I'm going to hand it off to our CNM, our nurse midwife, Jessica Brumley.
Thank you, Margie. I love that all of our professional organizations have such amazing resources that can be adapted for for this purpose. We're gonna start with a post-it activity. Can you think of a time when someone's kindness had an impact on you? Please type it in the chat. This is actually an activity that we would start our workshops with. For those of you that attended our workshops, you may remember this. Oh, okay. This is my first time doing this post-it. Excellent. Okay. And so this is an activity. This is a way that you could modify that in-person activity that we did, right? So we had people put it on a post-it note as they were kind of filing into the workshop. And, people were coming in and I would say, hey, while you're waiting, can you just write on a sticky someone's act of kindness that was meaningful to them? I mean, anything like, I think I remember one, they had breakfast with their nurse manager that morning before they came to the, to the training, and, and they just did that.
I'm sorry, but who do we disrespect? Like, is there a single person you can think of that? Even the mean ones are like, who paid them back? They must.
Thanks. Yeah. So engaged.
And so this is a way for you to engage in that kind of activity virtually. So if you're attending a virtual meeting, this could be a quick activity, and then you read them out, right? An act of kindness was my birth plan was respected. A kind word to me when I was down, prayed with me before my birth, gave me tissues when I was crying. It really can seem so so very small to the person who's doing the act of kindness, but can really be so meaningful to the person on the receiving end of that kindness. And I like to start in this place of positivity, right? In thinking about what it is that we do so well and do so right, and how it is that we have impact on the people around us. And I think this activity does that well. I love it. So, you know, so many people having experiences that they can share. Yeah. I think we can move to the next slide. We just wanted you to get a feel for what this would look like virtually, and how great that is. Awesome. Next slide. We have really placed value on centering the voices of Florida's mothers, and it's a, you know, it is a whole pillar of you know, it's one of our major aims in the project is you know, surveying our patients' experiences regarding their respectful care experiences. And for those of you that attended our project kickoff, you saw a few Florida mothers, right, who were on our mother advisory board, share their stories. And I think everybody really recognized how powerful that was. And it really made them feel like motivated. Like I could feel the energy was really palpable, you know, around that. And so really thinking about how do we tap into that to help with that lack of perceived interest that I heard you guys report out, you know, in the beginning, or thinking that, you know, lack of thinking that, you know, it's needed, right? When you are hearing from the voices of the people that you're caring for about their experiences, I think that can be a powerful driver into helping to create change. And so in our workshop, we have quotes from some of our advisors, such as that was there. And so the workshop that we offered is founded on the International Confederation of Midwives Respectful Maternity Care curriculum. It's called the Respect Workshop. And we liked it for a few reasons. One is that it was available completely free of charge on their website, you know, not password protected in any way. It came with not just the slide deck, but also an entire toolkit, including a facilitator guide. And the facilitator guide is actually what we use to develop our train the trainer sessions that we held throughout the state. And so this can be used to train people in your institution to give, right, multiple versions of the workshop, you know, imagining how many you'd need if you were training a couple hundred people. And then it can also be used as a standalone workshop. And ICM has intended it to be used for basically all people who are involved in providing maternity care. And so really, you know, it can be modified to all those working in our hospital. And I think the reason why Nicole and I liked it the most is because it has such a strong focus on experiential learning, right? And so activities such as, you know, the one that we just participated in are built into this workshop. You don't have to think about it. It is all laid out for you, and there's so many. And we know that learning is a process whereby knowledge is created through the transformation of experience. And so engaging in this work in that way can really help to shift mindsets and we believe therefore care practices. Next slide. This workshop is rooted in, theoretical frameworks such as adult learning theory. The facilitation recommendations are grounded in three core conditions for a successful facilitation. And it also utilizes the stages of group development, right? Like it recognizes how teams grow, tackle problems, and get results. And so it starts with this point of trying to just acknowledge that that there is a problem and that work needs to be done. And so, you sort of start with that, what is it? Storming, forming, norming, and so, it moves through to this point where you acknowledge that work needs to be done and then provides you with strategies on how to create change. And then it ends with this sort of call to action, right? This really wanting to light a fire to create change. And so they've really laid it out well in that way. Next slide. We adapted this curriculum for our purposes. And that is one of the benefits of this workshop. It is that it is so adaptable. You can use this respect curriculum to talk about the building of respect and what resources are available. You can use the recommended key components that we have provided. They're listed here, on this screen, right? Addressing topics such as cultural humility and recognizing healthcare worker burnout. I love that it gets people thinking about our own workplace and how we interact with each other and how that impacts how patient care is provided. And so these key components were created by the Respectful Maternity Care Work Group that was part of the advisory committee that helped to create our FPQC toolkit. Dr. Brown and I were both on that work group. And then we adapted, as Nicole said, right? We had these resources. We had some already created, some we created specifically for this initiative, some specifically for this workshop. And so we have like the Respectful Care Workshop tips for trainers and key takeaways. Another tool is the commitment for every patient, right? So our sort of like the pledge or commitment that we've asked our team members to sign. And when we created that, the intention was that we would have really actionable items that could be implemented. We also have the trauma-informed care handout that we originally created for the PAC initiative. Inclusive and equitable patient care SBAR. So these are created by AWHONN, and so those are there are several of these that AWHONN has created as a tool for how we communicate about patients. In fall of 2023, we started offering trainings or train the trainer sessions. And as I mentioned, these sessions really focused on experiential learning activities. And so if you're going to hold in-person workshops, as many of these that you can incorporate into it, I think are really important. And really the only materials that we needed were some large wall Post-its, and then some regular size Post-it notes, some markers to write down headings on the large Post-its. And then we had a few role play scenarios. And so we would print out a couple copies of that and hand those out ahead of time. We used a list of sort of ground rules, expectations right in the beginning, but one strategy is to have the team, right? Have your attendees kind of come up with what ground rules are important to them, and then write that out on a large Post-it. If you're wanting to save time, you kind of come up with the list, review it with folks, and see if they want to add anything else. And then the other activity that I thought was really powerful. So if you're just trying to get, I think, interest or kind of get people to want to attend the training, right? Like want to do the module that you're suggesting, then there's, I think, two activities that I think are really helpful. And one is sort of you have everyone stand up. You're kind of at a point where you're like, okay, everybody stand up, stretch out. And then you ask them to have a seat if they've never experienced disrespect. And I've taught this workshop now like 7 times and no one ever sits down. It is like a part of the human experience, right? I mean, we if you interact with other people ever, you will experience disrespect. But it's powerful to just kind of recognize that and sit in that for just one moment and look around and realize that we all have this experience. It is this shared experience. And then the next is to have everyone write on Post-it notes, or if you're doing it virtually, maybe you're attending like a virtual department meeting or physicians meeting, right? You could have a link or a Post-it note activity or something like that where they can just write down their experiences of disrespect, anything that they have witnessed, or either it's patient care or between a colleague in sort of the work setting. And it's really, really powerful. And also it's amazing how many similar experiences of disrespect. There were definitely lots of themes that we noticed. We took, pictures of all of the large Post-its with the little Post-its on it. And, they fell into themes. I think those are two really powerful activities that can help people to understand why this is so important and to help to motivate participation in, in the education and engagement. And then the other is just a role play activity, right? And so we kind of adapted one that is, a patient who's needing to be induced, or the recommendation is for induction, and kind of what a rushed sort of like probably pretty routine conversation, honestly, can look like, versus an engaged sort of shared decision-making kind of conversation around that can look like. And you can modify, you can create any scenario and do that same thing, in person particularly. Yeah, next slide. I think, Nicole, is this where you take over?
Yeah. So Jessica and I had the privilege of traveling the state last fall and implementing our adapted respect workshops. 114 attendees in total. We went to Bayfront Health St. Pete, Early Learning Coalition in Broward, Mount Sinai in Miami Beach, Sacred Heart Emerald Coast, up in the Panhandle, and then Advent Health Daytona. So really great spread and super fun and well received. And I just want to show you really quick so we can get to Q&A and stuff. But this was some initial findings from our evaluations. Those of you who attended our trainings remember that on the opening slide, there was a QR code that you could scan with your phone. And then we had to do the same thing at the end. So we sort of did a pre-post style to see, gauge changes in knowledge, attitudes, and self-efficacy. And then separately at the end, we also did an evaluation where people could answer sort of more open-ended questions. But we found some great things. And if you are interested in taking a workshop and modifying it, it was really easy for us to link a QR code to a survey that we designed in Qualtrics. And then just basically we asked them at the beginning and at the end to gauge change. So it was really easy. It's something that you could do in your facility if you're interested in looking at the same sort of information. We are happy to share those questions with you if you want to use that for your own education offerings. So but just here you can see really quick, this is just from our trainings in the fall. We saw statistically significant improvements in these following domains. So we found that at the end of the intervention, participants found that disrespect during maternity care is a human rights violation, that attempting to convince a patient into a medical intervention that they believe that believe it is disrespectful care. Experiences in which a patient feels mistreated may lead to slow or stalled labor. Shared decision-making includes providing the patient with unbiased information on all of their care and treatment options. Ongoing labor support, such as that from a doula, is an important tool for improving labor and delivery outcomes. We also find improvements in attitude, such as is it important to confront colleagues who provide disrespectful care, and that there's a zero tolerance for disrespectful care, which includes providing clear feedback to colleagues. And then lastly, we saw improvements in self-efficacy, or I should say differences in self-efficacy. We found participants were more comfortable providing feedback to a colleague when they witnessed disrespectful care. And these domains we pulled from a lot of existing literature on RMC. So we didn't pull this out of thin air. We used established literature to ask these questions. And we're very excited about the finding and hope to publish them very, very soon. Now I'm going to pass this over to Margie. And I know this is one of the reasons that you guys are here. How do we do this? Margie.
Yes, yes. Thank you, Nicole. And before I get to nursing leader promising practices, I really want to hear again from Dr. Alyssa Brown as our OB and Dr. Jessica Brumley, who's our nurse midwife, because you have done a lot of this. Dr. Brown, from an OB perspective, I listed some things, but what do you think as far as training practices? What do doctors want to hear?
Yeah, I think doctors love choice. They don't like necessarily being told what to do. So really implementing multiple strategies on this list, depending on the size and specific challenges of your site. I come from an institution where we have a large number of trainees, and I know many of you have affiliated training programs as well. Residents are huge change makers in any healthcare organization. And so if you have trainees, I would say always start with your residents. They are leaders, they're providing that care. And so they can really help draw in more physician support. So for sure, I'd like to highlight that. I think utilizing the e-modules allows practitioners who are busy and maybe they're only coming to the hospital once or twice a week and they can be hard to capture in, a one-time setting. So it gives them a little bit of flexibility. But I think providing docs with many ways to satisfy that education requirement is really helpful. And then like Jessica said, really kind of tying in those patient stories. So, many of you talked about like the lack of interest. And so really kind of getting that interest spurred so that people want to complete the education. And I think it's, really good to come from a place of offering the training as no one is an expert, right? I'm not telling you what to do. We recognize this is a problem for all of us and we all should be lifelong learners. And so I think putting it in that framework and having different offerings will likely be the most successful when it comes to engaging docs in the process.
Thank you. And Jessica, you had the privilege of going to District 12 ACOG, correct? And present and the resident training.
Yeah, I mean, you meet them where they are, right? Like, so, where are they congregating already? Are they, do they have a department meeting or division meeting or faculty meeting or, try and go, where they are already? Is there a grand rounds, opportunity? Do they usually do lunch and learn series? Is that right? Like, so just trying to figure out like, how do they meet? And it may be multiple small, right, kind of meetings, right? If you're at a hospital with lots of small groups that, that are, a part of it, then their needs all might be a little bit different. And so, going to ACOG was amazing and everyone was super engaged. And I have to say, like, what the title of my small little breakout session workshop was, was different than sort of what it ended up being. So I'm not sure people knew what they were showing up for, but they totally engaged and totally like, participated. And I did 25 minutes and I started with those same activities I just talked about, and everybody stood up and everybody had an example to share and everybody wanted to talk about this. And then I also got into some of the strategies because we talk about things like mindfulness and deep listening. And they afterwards, they said, these are just life skills. Like everybody needs to hear about this.
Yes, exactly. And on the next slide, many of the ones you mentioned, I'll go into for the nurse leaders on the call. You know, we've already talked about a lot of this, but remember, take bite-sized pieces at a time. Take it to your unit-based councils. We've got scripting. Get those, work with your medical staff office to get those ACOG modules uploaded onto whatever learning platform that providers like to use. Having that commitment banner where the doctors also sign it, and talking at pearls at your huddle time, mentioning any of the pearls. And also, if you have a perinatal safety meeting, keep that as a standing agenda item. So on the next slide, I'm just going to tell you, this is available for later for you to look closely at, but this is just a couple of QI tools. It's a PDSA cycle on how one hospital did the RMC rollout. The other is a 30, 60, 90-day plan that really looked at a SWOT analysis. So you'll have that later. And on the next slide, this is posted activity number 3. And the idea is you are going to chat in, please, anything you are going to do in the next 30 days to increase RMC education on your unit. Please type into the chat any thoughts you have. We really want to hear from you all. Is there anything that really stuck with you that you can do by Tuesday, or you can do in the next 30 days? Something you heard today, because we do want to leave time for Q&A. Alyssa's going to facilitate that next. But do you have any thoughts on something you can do by Tuesday or in the next 30 days? Ben, is there anything coming in the chat?
We have engaging with residents.
Oh, yes. Engaging with residents. Awesome.
Share at OB department meetings, engage our residents. Attending the RMC workshop and mid-initiative meeting.
Yes, there's a pre-con available. Jessica and Nicole will be there for the pre-con the day before. Thank you.
Discuss
Go ahead.
small group in services with staffs and providers. Include it in the OBGYN medical department meeting.
Awesome. Well, these are fantastic. We will get them all up for you, and this will be a part of the recorded piece for you to get those all typed in and posted for you, and we will getting this out for you. But we wanted to leave time for Q&A, and Dr. Alyssa Brown is going to facilitate this as our OB. Any questions? Go ahead, Alyssa, take it away.
Yeah, thank you guys for joining us. Hopefully you have gained some strategies to help improve training really amongst everybody. I know it was really physician focused, but this is kind of our opportunity to chat a little bit more. You can also write questions in the chat function, or if you want to just verbalize it, this is a time where you can unmute and ask any of us any questions that you may have. Comments are also welcomed.
Ira.
Yeah, you know, I think when you go back to the slide where you were talking about the ACOG EGA modules, you know, and they kind of hint at the fact that a lot of patients are holding back information because physicians seem rushed, you know. I think when I think about the majority of the docs that I work with, I think most of them are good human beings and they got into this for the right reason, but yet they're stuck in a business model that does not allow them the time that is really required to be respectful sometimes, you know? And I just was curious if anyone has had any success on speaking to that in the way of, you know, if you find yourself in these situations over and over again, have you ever considered changing your business model to maybe free up time a little bit more? I mean, I know it's difficult. I mean, the reimbursements are terrible after everything trickles down from the private equity groups that own us all. It's a very small pie. But I don't know if anybody's had any success with trying that angle with some of the docs.
I haven't tried that angle specifically, but there is some well-established data that shows even with time constraints, if a physician can walk into the room and build trust and some type of social connection with the patient, that patient perspective is that they've spent far longer in the room. And so, you know, practices may have a lot of constraints about how many patients they need to see or the volume, and that's harder to change, especially in the scope of this initiative. But what we can give you is strategies and tools to connect, ways to communicate with patients that enhance the likelihood of building trust to a point where you will be able to get the information that you need. And that's kind of the focus that I would do. We'll give you some tips and skills to help you better relate to your patients so that they don't feel that you're being rushed. So I can be in the room for 3 to 5 minutes, hopefully more than that, but sometimes that's what it is. But how do I relate with that patient, and how do they feel heard in that small time frame?
The other thing I was going to say too is the other times that I feel like I've seen other people or myself get into situations where I'm pressuring people to go down a certain decision, route, like trying to talk somebody into a C-section because of a bad tracing, for example, a lot of that is because I feel an immense pressure from legal issues, and I think some of it is just born out of our own personal ignorance of like where is the law really going to come down on you in one of these situations. And I wish that we could give the docs some better insight or ways to handle those situations, to say, if you educate the patient in this specific manner and documented this, that this was your intervention that you suggested, and things go bad, that you're not going to get burned, so that you don't have to push them so hard. I don't know if there's some way to give.
Yeah, part of that e-module reading list, there is a ACOG committee opinion specifically on effective patient physician communication, and some of that is in there. So I think, that 20-minute e-module is not going to give you all of those skills, but if you really are hoping to get a little bit more information, there are supplements, and that reading list is a major supplement where they give you those skills and those tools. Because I think a lot of it, and this is kind of outside the scope of this talk, but is a shift in our profession of what does it mean to give informed consent, and what does it mean to have shared decision making. And so I think that is what we're wrestling with as a healthcare industry, and what services we provide to patients. And so it is a mind shift. It is a but I think that there are great thoughts in literature about this specific topic. And so there are a lot of ways to have tangible things that you can walk away with as strategies to improve patient-physician communication.
Thank you.
And it's not just us, right? In perinatal care that are dealing with this. Our own hospital has a hospital-wide grand rounds next week. Shared decision, when shared decision making isn't shared, right? Like when patients are making choices that we wouldn't make for them, and how do you handle that? This is the reality of all of us working in healthcare. It is hard to sit in that discomfort and to figure it out, for sure. Yeah.
The only thing I would add is that there's evidence around just sitting down. When a doctor comes in a room, actually sits, there's more evidence coming out about that. I'm sure you already knew that, but I just thought I would throw that out there, because I know also as a patient, if my doctor's sitting and looking at me, what a difference.
Yeah. Yeah.
Were there other questions? Alrighty.
Nicole, I'm just curious if there were any other doctors on the call. Do they have any other comments about this, or any questions?
I think we have a list of suggestions that we can give the District 12 Planning Committee meeting.
Yeah.
of topics to include, right? That reading list, like those could be breakout sessions. I mean, yeah.
Yeah, and I definitely see in the chat regarding what can you do in the next 30 days, I did see some physicians chat into their what their plans were. So I know that this is an endeavor that our providers are taking on too, and we really appreciate it. So I guess we just want to sort of close out the webinar now. Lori, any last comments as our
Just to say, wow, fantastic presentations from our clinical leadership. Thank you all very much for sharing your expertise, your wisdom, and your talent with us today. I hope it inspires people in the webinar to go back and implement at least one of the suggestions that were listed on our post-it board and our chat. And I want to thank you all for joining us. And with that, we will close and let you go.